This is a short information video on the coronavirus disease, otherwise known as COVID-19. We're going to look at what COVID-19 is, what can be done to prevent the spread of infection, the symptoms associated with the coronavirus. We're going to look at advice for those at higher risk and for people who are older and most at risk, guidance for learners and how to look after your well-being, and also some important contact details. COVID-19 is a new illness that can affect your lungs and airways. It's caused by a type of virus called coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you practice respiratory etiquette, for example by coughing into a flexed elbow. Help stop the infection from spreading by following some do's and don'ts. Wash your hands frequently. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based rub kills viruses that may be on your hands. Maintain social distancing. Maintain at least 2 meters, which is 6 feet, distance between yourself and anyone who is coughing or sneezing. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth which may contain the virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. Avoid touching eyes, nose and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and make you sick. Practice respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with a bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as a cold, flu and COVID-19. So let's look at the symptoms. High temperature. This means you feel hot to the touch on your chest or back. A new continuous cough. This means coughing a lot for more than an hour or 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. Do not leave your home if you have either of the above symptoms. To protect others, do not go to places like a GP surgery, pharmacy or hospital. Stay at home. Babies and children, call 111 for advice if you're worried about a baby or child. If they seem very unwell, are getting worse, or you think there's something seriously wrong, call 999. Do not delay getting help if you're worried. Trust your instincts. Anyone who has these symptoms must stay at home until the symptoms have ended, and in all cases for at least 7 days. Everyone else in the household must stay at home for at least 14 days after the first person's symptoms appear, even if they themselves do not have symptoms. If anyone else develops symptoms during that time, that individual must stay at home for an additional 7 days from when they developed symptoms. Once 7 days have passed and provided symptoms have ended, they no longer need to isolate. Advice for those who are 70 and over, have an underlying health condition or are pregnant. People who are 70 and over or those who have an underlying health condition are likely to be more seriously affected. It is even more important you protect yourself now by following the advice provided. The advice for people who may be at increased risk from the coronavirus is the same as for most other people. You should only leave the house for very limited purposes, such as shopping for basic necessities, for example food and medicine, which must be as infrequent as possible. One form of exercise a day, for example a run, walk or cycle, alone or with members of your household. For any medical need, including to donate blood, to avoid or escape risk of injury or harm, or to provide care or to help a vulnerable person. Travelling for work purposes, but only where you cannot work from home. People most at risk from coronavirus are sometimes called shielded or extremely vulnerable people. This includes people who have had an organ transplant, are having certain types of cancer treatment, have blood or bone marrow cancer such as leukemia, have a severe lung condition such as cystic fibrosis or severe asthma, have a condition or are taking medication that makes them much more likely to get the infection, are pregnant and have a serious heart condition. There are many things you can try to help you to stay well. Stay in touch with family and friends over the phone or on social media. Why not spend time doing things you really enjoy, such as reading, cooking, indoor hobbies, listening to the radio, or even watching TV? Doing some light exercise at home. Spending time with the windows open to let in fresh air. Spend more time in the garden or on your doorstep if possible, but stay at least 2 metres away from other people. Why not read the advice about how to look after your mental well-being while staying at home from Every Mind Matters? There is also lots of advice from gov.uk on well-being and autism, dementia, learning disabilities, older people and mental health conditions. Help stop the spread of infection with good hand hygiene. It's important when you're washing your hands, you use soap and water, and you do this often. You must also do this for at least 20 seconds. You start by washing palm to palm, the backs of the hands in between the fingers, the backs of the fingers, the thumbs and the tips of the fingers. Now let's watch a short video clip of how to do this effectively.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam, then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe. Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Let's look at what to do if you need medical help. If you need medical help for any reason, do not go to places like GP surgery, pharmacy or hospital. If you have symptoms of coronavirus, use the 111 NHS coronavirus service. If you need help or advice not related to coronavirus, please use the NHS website or your GP surgery website. For urgent medical help, use the NHS 111 online service. Only call 111 if you're unable to get help online. For life-threatening emergencies, call 999 for an ambulance. And for more advice about getting medical help at home, visit the NHS website at www.nhs.uk. Despite care having been taken to ensure the content is accurate, it is possible that clinical information and advice may have changed since its production. For latest information, please visit www.nhs.uk/conditions/coronavirus. At Peer Training, we are committed to helping to spread the single most important message, which is stay at home, protect the NHS, save lives.